I'll now invite each of our students to please introduce yourselves to give us an overview of your degree and study experiences here at Monash. Maisie, can we please start with you?
Yeah, for sure. Hi there, my name is Maisie. I'm currently studying my second year of a Bachelor of Paramedicine down at Monash University's Peninsula campus. Initially, though, I chose Monash a few years ago now because initially I did see that it was in the top 100 universities in the world, and I was immediately drawn to that, being a little Year 12 student that I was. But after a few further investigations, I looked into what studying at Monash would really be like, and I was completely blown away at the amount of staff that Monash really offers you. I've had countless opportunities now to speak to different staff members that have come from the UK practicing as a paramedic or just down in Victoria practicing as a paramedic, and they've gone to all these incredible cases and told us all these personal stories that they've had, and it's given us a really in-depth perspective of what it'll be like working as a paramedic eventually. Personally, though, as well, I had a friend at my school at the time, and she was learning to be a paramedic at Monash when I was in Year 12 and she was in her final year at Monash. And she told me thousands of times, she's like, you have to study here. It's incredible. The facilities are insane. Like, you have to do it. And I was like, okay, fine. And then I just wrote it down on my VTAC application, and I do not regret it to this day. Definitely in the past, though, being at Monash, I found practicing the scenarios and being able to participate hands-on has been incredible. And I've really been blown away with the experience because we have every single piece of equipment you can imagine, everything that the AV trucks have, Ambulance Victoria trucks have, Monash has. We've got 2 life-size realistic trucks down at Monash Peninsula, and it's been insane. I really love being able to go in the trucks and actually feel like a paramedic, get to put on my uniform and crack open all the ampoules and get all the syringes out and get really hands-on, which has been super fun, and all the fake blood and everything. I feel like a kid, but it is really, really fun. And definitely the scenarios are my favourite part about studying the course, and you really get to do a lot and you get to interact with your peers and bounce off one another, which I found incredible. Down at Peninsula as well, it is away from the hustle and bustle of Clayton campus, but I really have grown to love it so much. It's not too far of a drive, and I really love the drive. It calms me down before a scenario or something. And the facilities are incredible because we have like a dedicated paramedicine facility, and you get to go into the rooms and everything, and there's everything you can imagine there. All the dummies are just lying there ready to be worked on. But the best part I've really experienced, though, has been going on placements. I've done 2 2-week placements now in Geelong and Diamond Creek. And Geelong was a bit of a rural placement, but I really found it incredible because Geelong is my hometown. So it was nice to get out on the trucks and look around and see what it actually will be like when I become a paramedic in the future. And I've really loved the course, although there has been some challenges, but that's with everything that you do. I've really worked through it, and I've had such amazing support from all the staff at Monash. And yeah, that's my experience as a student at Monash.
Awesome. Thank you very much. Brian, can we move on to you, please?
Sure thing. Hey everyone, my name's Brian. I'm a 4th and final year student for Bachelor of Physio Honours. I chose the physio course for 2 main reasons. Firstly, classic watching and playing sport during high school, like always got me pumped up. I wasn't particularly good at any sport, by the way. You don't have to be like a first 11 athlete to like sport. I just had a passion for it. I would go home every weekend, play footy in the morning, come home, become a waste man and just watch it all day as well. And I guess I loved all sports and seeing the injuries that happened during the game. I always wanted to know like what the medical team and the physios did to help my like favorite players get back on the field. The second reason why I chose physio was in year 12, I felt most confident in my speaking skills. Like that's just something that I prided myself in. And I knew that physio was considered quite a social job. And I love talking, I love listening, probably more than sitting down and writing a computer or something per se. Firstly, my course is the only undergraduate option for physio at Monash. I chose Monash initially because I'd heard really good things about the students here from physios who are already working in hospitals. So not to compare to any other unis, but a friend's dad did specifically tell me he loved working with Monash students. They seem to be the most well-rounded. So yeah, other than that, I had a lot of high school mates coming to Monash as well. What I love most about the course is probably you have placements organized for you and you actually get to know what work is like before you go into the workforce. placements do kind of feel like full-time work. It's a lot to juggle around, but it's really great because you get a good understanding of what the job responsibilities really are, and then you get to pick and choose maybe, oh, like I like this area a bit better than that area, so that way you're not graduating working blind. Yeah, it's a good heads up. In terms of like extracurriculars with this, you know, I've been part of the Physio Society. We have like annual pub crawls and balls, not this year. I was briefly part of some other things like just the uni's General Philharmonic Orchestra, but yeah, it's always great to juggle some stuff around. I'm done with all my placements now, so I've worked in a mixture of hospitals and clinics. It can be kind of stressful, and you do have to sacrifice your time and part-time work, but you get to work with actual clients, so no matter how they teach it, that can't be replicated anywhere else. Yeah, all I'd say is after placements, it's great because I feel super confident about the role. I know that if someone gave me a job, a pager, and told me, you're this ward's physio for the day, go do your job, I would, because of the education I've gotten, I would like just reply, cool, I'll get cracking. And yeah, that's everything in a nutshell.
That sounds awesome. Thank you very much. Maddie, can we move on to you, please?
Sure. Hey guys, I'm Maddie and I'm a third year occupational therapy student. So deciding to do this, I was a little unsure. I did another degree at Monash for health sciences and knew that I wanted to pursue something more clinical or hospital based and that had a bit more interactions with patients. My auntie's a nurse and she's like, OT, what about OT, Maddie? And so I looked into it and it just sounded really good. And then, yeah, my last degree with Monash was just very supportive and had a good reputation. So I thought Monash for OT was a perfect choice. And yeah, so the environment and supports of Monash for this degree has made it so easy to get back into uni life. And the OT cohort have been extremely friendly and welcoming. I remember on campus, like within the first couple of weeks, I would walk past someone I would walk past someone I haven't even had a class with, and they would ask me how my assignments are going. So I really liked how the Peninsula campus is small enough to allow that, and it definitely gave a good sense of community. And there were heaps of services available for Monash to help with like referencing and all the things to help you transition into from school to university. Something I love about studying OT is the diversity in its content. As it is such a broad profession, you get exposure to a large area of work. So we're looking at geriatrics, which is the older population, and then we can look at pediatrics, which is younger, and then mental health, young people with disabilities, stroke, hand therapy, like there's so much. And then we also can work in community-based or hospital-based or do home visits. So we really, throughout the course, get a wide range of exposure to everything, which is really interesting. And then something that I've loved is the placements. So in second year, I had a 3-week placement, and that was at Windermere Early Learning Centre in Mornington Peninsula. So that was a paediatric placement where we got to do some assessments with kids, and I was lucky enough to have a 4th year student with me. So we did some interventions, which are very creative and playful with kids. And then a couple months ago, I actually completed a 7-week placement at the Angus Hospital in the acute ward, which was amazing. It's funny how you can go to uni, learn all these things, but putting into practice really does make everything come to light and spark that passion for the work. So I was able to work with the multidisciplinary team, your nursing staff, your physios, and attend daily meetings with the doctors and do discharge planning. It was a great experience. And then currently I'm doing a project placement with mental health services, working with the dual diagnosis teams, where we're working on a project together to really get a range of opportunities and in a range of different settings. But yeah, OT is very diverse, and you work with a range of populations and groups, and there's lots of choice. And I've enjoyed it so far, and Monash has really supported and given me those opportunities to explore that. Yeah.
Awesome. Thank you very much. Thank you for those introductions. We will now move into the Q&A portion of this morning. So, Maisie, what sort of assistance is there in regards to preparation and training for the challenging and potentially traumatic sides of paramedicine?
Definitely, there's heaps of teachers that we have that have experienced different things on placement, whether it be really high-profile cases that everyone knows about and has heard about in the news and things. They tell us what you're willing to expect, and we really get exposed to it in the prac rooms, and we talk about it and talk through everything. After a big kind of 2-week placement, we'll come back to uni, and I know that I have my peers to talk to, and I have the teachers to talk to if I see anything that is potentially quite traumatic. And also, if we see something on placement that is traumatic, you always have the 2 paramedics that you're on placement with to talk to as well. And I've really appreciated their help.
Awesome. Brian, can you specialize in any area of physio at Monash?
So in the undergraduate course, you finish with a general physio degree. So you can choose to specialize after working in the field. So it takes a few more years of usually clinical practice, and you might do a master's in some cases. There's like a whole nother process. So short answer for the undergraduate, no, but the placements you get to go to kind of introduce you to each specialization.
That's cool. Maddie, what do OTs do, and what are the differences from physiotherapy?
So I feel like physios focus more on how people move and what impacts their movement and their mobility, when OTs really look at what people are doing and how people are doing things and what are they doing, who are they doing with. So OTs help individuals do things they want to do, and if people are have a disability or a condition that stops that, we kind of look at ways through like retraining, prescribing aids, or looking at services to assist those individuals in doing those things again, if that's as simple as cooking, or if they wanted to go back to work or something like that.
Yeah, cool. So Maisie, what other career options are available for paramedics?
So with the paramedicine degree at Monash, it is specifically tailored to the clinical practice guidelines that you learn with Ambulance Victoria, but it is you can take it to any state within Australia, and you can take it anywhere in the world. Everywhere needs paramedics if you think about it, but a lot of the students from Monash have gone over to the UK. Personally, I know that I really want to study further, and I don't know whether I want to go into a master's and go into research, or I'm thinking about maybe going into nursing and doing further study from that. But really, there's any opportunity. It is what you make of it, for sure.
So Brian, in physiotherapy, what proportion of contact hours are lectures and tutorials?
I would say it depends on the year, but for first year, I would ballpark it as maybe 40% lectures, 40% pracs, and 20% tutorials. It depends on what your definition of tutorials are, I guess. If you mean more the traditional sense of you're in a classroom and you answer questions about lecture content, then yeah, only around 20%. But if you're including pracs as part of tutorials, then it becomes more like 40% lectures and then 60% doing stuff, I'd say.
Cool. So Maddie, how physically demanding is working in OT as a career and also in the placements?
I don't think it's overly physically demanding. You do have to do a bit of manual handling when you're with some clients, but you do get training with that, and there are safety protocols in those settings. So you would never be at risk, or they wouldn't push you beyond your limits, and you would definitely have training in that, and there's definitely guidelines in the settings as well.
Cool. So another question for Maisie. Where do you go on placement? Is it only on road or do you get to go into hospitals for placement as well?
So personally, so far I've only done placements on road. In my first year I did non-emerge placement, so it was one day during the week and you'd be a non-emerge, so just taking patients to and from hospital in cases that weren't that intense. And then at the end of the year I did an emergency placement with AV. But personally I haven't done hospital placements yet, but I am looking forward to going into the hospitals and getting hands-on in a different setting other than on road.
Yeah, cool. So Brian, another placement-based question. Where do you get to go for physiotherapy placement?
So first things first, they're decided for you, although you can put in preferences for, it depends on, like where you live. They take that into consideration. But majority that I got to go to were in the public health system. So that meant like big hospitals. For example, I was in a hospital around the Monash Health area, like on the wards for about 4 of my placements. And then in a smaller community center, which is where they do it's like a small clinic where you just work with rehabbing patients who were previously in the hospital setting. Yeah, you can also go to smaller hospitals and you can do placements in rural areas as well, so that it's really different. And you also have one elective placement in 4th year, or at least I did, where you can choose to do something that maybe the uni hasn't given you directly. So it could be like private practice, or it could be something more specialized, like you really want to learn about, I don't know, like you're really into sports injuries kind of thing.
That's very cool. So Maddie, we have a question here about what career options are there for OTs?
So one thing that's so appealing about OT is the diversity in career paths. You can work in many places and with many conditions. So you can be in the hospital, in many settings in the hospital as well. So you could be acute based or more inpatient rehabilitation, or even in the emergency departments. Then we have, you could be a hand therapist, you could be in schools, in the mental health services, you could be a caseworker for NDIS or disability service agencies. You can also be in like a driving assessor, fully in pediatrics. Like, yeah, it's very diverse. There's many career options with OT. Yeah.
Yeah, cool. So a more general question here for you, Maisie. What has been the highlight of your degree so far?
Definitely it would be the placements and the more hands-on scenario-based subjects that we've done. So my favorite one would be trauma at the moment. We're learning really hands-on kind of techniques of how to manage a hemorrhage, how to manage an amputation, things like that, which is it's making me feel like a kid because I get so excited at like getting hands-on and being able to tie up a bandage and stuff. But it is really fun and I've enjoyed it so much.
Yeah, that sounds really awesome. So Brian, are there any elective units in physiotherapy?
Not exactly. So all units are mapped out for you. Every unit is compulsory. It's just that you get an elective placement unit where you get to put in preferences for where you might want to go. And you are also allowed to try to organize it yourself. And there's a whole process there. So for me, I had an elective placement as my final placement, which I finished up last week. I went to a private practice because it was just like a different vibe to working on the ward in the hospitals with doctors, just something different so that you get a good exposure. You're not walking, as I said, like you're not graduating blind for that sector. And yeah, I think that's the only opportunity to do elective units.
Yeah, cool. So Maddie, what are the facilities like for OT students at Monash, and do you have much hands-on learning outside of placements?
Yeah, so Yeah, sorry. Facilities are very good. You do have to do some labs, so you get involvement with that. And then quite a bit of hands-on learning actually, to learn all the equipment, to learn your manual handling. They also simulate like a hospital environment, and do like a scenario-based learning where you have like a pretend client type of thing, but you have access to all the equipment you would prescribe or the interventions you would give to people, and you get to practice with that as well. So you do get quite a bit of hands-on learning with everything, and they do try and involve that as much in the course as possible.
Yeah, that sounds really cool. So another question here for Maisie. What are the on-site hours for a first-year paramedicine student, and at what stage do you move into placements?
So thinking back to my first year, it seems like so long ago. There were 4 units, and pretty much the three of the units, it was 1 hour lecture, 1 hour tutorial, or 2 hour tutorial, depending on the unit. And then there was the more hands-on unit, which was, I think it was a 2 hour lecture and a 3 hour kind of prac class where you're hands-on with all the dummies and everything. And moving into placements, I know you did pretty much, I think it was 5 placements of non-emerge in the first semester, and then 5 placements of non-emerge again in the second semester of first year. And then in the break, between the summer break, pretty much, there was two-week placement with Ambulance Victoria, which I was so nervous for, but I was really prepared with Monash, but it was so fun. It's definitely worth it. And non-emerge isn't like, it isn't as intense, but you definitely get to learn a lot more in non-emerge.
Yeah, cool. So I have a question here for all of you. So we'll start with Maisie answering first. So what advice do you have for someone considering a career in health?
Oh, advice. Okay. Definitely, I know that I'm a real people person, and that's why I really wanted to get into health. And I did think about it for a while. I was like, do I want to do science or do I want to do health? And it was definitely something that I had to sit back for a bit and have a good think about and be like, is this the career for me? And I went around to different family members, family friends who worked in health, and they recommended the pros and cons. And I really tried to think about my future and what it would mean and everything. But I did do a pros and cons list and thought about it for a really long time.
Okay, Brian, what's your advice for someone considering a career in health?
Firstly, just know why you want to do it. Like, be prepared to be able to answer that question. So for me, it was really like, just the love of love of the sports, love of the human body, love of memorizing kind of stuff, love of knowing more about like the human body, I guess. Also, just be prepared as a student to do more memory-based content at the beginning of the course. So this will take a lot of like consistent revision, like lifelong learning kind of thing. You need to be constantly revising. It's not like some other courses where it seems as though once you finish up a unit, then you move on to the next one, and you might not remember the unit before. Everything builds up. It's like it accumulates. That'll be the same once you start a career in health as well. Just be able to apply what you've learned, but always go back and keep learning.
And what about you, Maddie? What's your advice?
Mine would be quite similar. Know why you want to get into it, and make sure you have some passion, because the study can be quite intense at times. But it's so far it's worth it, and you just really have to jump into it and ask questions and be confident in what you're learning, and what you're wanting to do.
So we asked Maisie this question before, but I'm going to field it over to you, Brian. So what has been the highlight of your degree so far?
So I've obviously loved my placements. I'd say that like one placement in particular at the start of the year was really great because it felt like a team, and it also felt as if I was a normal worker. Like I felt so supported and they trusted me so much. I think that's like a real big highlight. when you get to work with clients and they're putting their trust in you. Like you're a student, sure, you're still learning, but when they're like, oh, like, is that what I'm meant to be doing? Like, oh, that's so good. Like, teach me more about this. That's probably like when I feel most happy. Can I add one more highlight, which is just that meeting new friends, because like in the physio degree, it's such a small, tight-knit cohort. I think my cohort's low hundreds, like 110 people. So you pretty much, you get to know everyone, basically. So yeah, we all support each other, go on trips, not anymore. You talk about content, like even last night, we were just on a Zoom call, like just catching up. Like it's a really tight-knit cohort, which I love.
And what about you, Maddie? What's been the highlight of your degree so far?
Yeah, my highlight would probably be my last placement. It was just really where I felt I was able to grow, and I just felt really confident in what I was doing and in my abilities in doing it, and that I was actually helping people, and patients were reacting to what I was doing and listening. And yeah, it was just, yeah, placement's amazing. It really is a great experience.
And Maddie, we have another question here for you. So what is the class content like for learning to become an OT, and did you find it challenging?
Yeah, so at the first couple of years, there's a bit of bio, which is something, it's not my strongest suit, but it's something I enjoyed. But otherwise, we do lots of group work